today. Is that okay with you?
Yeah, sure.
Alright, so at some other times, I might need to place my hand in certain parts of your body, in certain areas, just to, I'm gonna be helping you out. Hey, is that okay with you?
Yeah.
Alright. And before I start and to tell you what we're gonna be doing today, I'm just gonna be introducing you to this call bell, okay?
Okay.
I wanna make sure that you have it with you at all times, alright? So if you don't see me, I'm not in your line of sight at any moment, you can just tap it and I'll come right to you, okay?
Okay.
Alright, so I'm just gonna leave it over here. This side. Alright, and do you know what we're gonna be doing today, Mr. Young, by any chance?
No, I do not.
Alright, so first, I'm gonna be helping you out, doing some bed mobility, and then I'm gonna help you out. I'm gonna be helping you move from the bed to the wheelchair, okay?
Okay.
And then we're gonna do some gait exercises, and then stair training. And do you by any chance know what gait training is?
Like the one outside my house?
No. Actually, what gait training is, I'm just gonna be helping you out due to the recent accident that you just had. I'm gonna be helping you out move your, or transfer yourself with crutches. You know what crutches are? Axillary crutches? Alright, I'm gonna be showing you those later. And I'm just gonna be helping you out, showing you how to move with them and how to get around, okay?
Okay.
And then we're gonna do some stair training. And is that okay with you? Yeah?
That's okay.
Alright. So before I get started on anything,
Okay.
I do wanna make sure how hard your heart is working. Okay, so I'm just gonna be checking on your vitals. Alright, so if you could please give me your left hand, and then I'm gonna put this in your middle finger. Alright, just check your vitals, you're doing great. Alright. Alright, Mr. Young, so you have the call right there with you. I'm just gonna put on your shoes, okay, real quick. Okay. I'm just gonna be putting on your shoe. Alright, how's that, good? You comfortable? Alright, wash my hands. Remember, you have the call bell right there with you. Alright. Again, remember, I just said wash my hands. And I'm just gonna be, I'm gonna bend your knee just a little bit like this. Alright. What I want you to do, I want you to meet me halfway for what we're gonna do, okay? For what we're about to do. The therapist yesterday told me that you helped them out halfway, and if today, if you can do more, that'd be great, okay?
Okay.
And before I put this around you, or on you, do you know what a gait belt is? Alright, this is pretty much for me to have a good point of contact with you, so I can help you out throughout the process of what we're gonna be doing today, okay? Is that okay with you? Yeah?
It's okay.
Alright, I just want you to put this on right here, and if you could just, do you know what a bridge is, by any chance? Have you seen a bridge?
I've seen a bridge.
Alright, so what I want you to do with this leg, you kind of do like a little bridge right here, so I can put this gait belt under you, okay? If you could just do that for me, real quick. If you could just, yeah, lift up just a little bit. Alright, just a little bit. Alright, that's good. Scooch down. If you could lift up a little bit for me again. Alright, there we go. That looks good. Is this uncomfortable or anything? No?
No.
Alright. Remember, if you feel any pain or discomfort at any moment, just let me know, okay?
Okay.
Alright. This is not too tight. No? Okay. Just making sure. Alright, Mr. Young. Call goes right there with you, but at this moment, I'm gonna be moving it over to this side, okay? Right over here. for what we're about to do, alright? Move it here. It's good, alright. I'm just gonna, nope, I should go. Alright, so I'm gonna put this on like this. Have you ever sniffed on your armpits? No? Alright, so,
Can't confirm or
alright, so what I want you to do right now, I want you to face this way and pretend that you're sniffing on your armpit right there. Yeah, that's great. You're doing great.
just like that.
Yeah, just like that.
I've never done it.
Alright. Alright, I'm just gonna be placing this arm like this, and what we're gonna be doing, I'm gonna be turning you on your side. Okay, I'm gonna be laying you on your side. Alright? And at the count of 3, I'm gonna turn you over. I want you to meet me halfway, just like you did yesterday, okay? So far, you're doing great. I just want you to keep on doing what you're doing, okay? Alright, so remember, at the count of 3, 1, 2, 3. Alright, that's good. How are you? How are you doing? Good. Alright, let me just make you more comfortable over here. Is that comfortable for you? Yep. Alright. So now, just make sure I get this. Okay. Alright. How's that? How you feeling? Good? Alright. So if you could just give me a little bit of space right here. There we go. And now with this arm, what I want you to do, I want you to put it right here on the bed. Alright? So at the count of 3, with that arm that you have right there, I want you to push up. Alright?
Yep.
And I'm gonna sit you up. Alright? So 1, 2, 3, push up. There we go. How's that? How you doing? Good? Alright. Alright, now I want you to lean your body on where my hand is right here. Alright, so I can just scoot you up. There we go. How you doing? Great? I'm just gonna scoot you forward. Just like this, if you could lean over to this side. Alright. Just gonna hold those right here, okay? How are you doing so far? Good? You feeling good? Alright, Mr. Young. So, what we're about to do right now, I'm gonna be helping you move from here to here, okay? But just like you did yesterday, I want you to do 50% of the work. I want you to meet me halfway. If you can do more than that, that would actually be great. Alright? But if not, it's totally fine. Alright? Alright, yeah. So, what I'm gonna be doing, from here, I'm gonna stand you up. When you're up, have you ever done a pivot before?
I have.
Alright, so I just want to make sure that on the balls of your feet, you're gonna pivot and pivot until I have you until I have you well positioned so you can sit right here on the chair, okay? You're gonna pivot to this side. Alright, with your left, sorry. Alright, so I'm just gonna be rocking you back and forth like this, and I'm gonna count down to 3. So it's gonna be like 1, 2, and then when I say 3, I want you to push off with your arms. Okay?
Yeah. Is there something missing before you go into that transfer? You did it, but you didn't do enough of it.
Or you want me to switch it a little more forward? Okay. Alright. You lean over to this side for me.
Whatever it is, just
Lean over to this side.
yeah.
Lean over to this side.
good?
You remember those instructions I told you earlier? I'm just gonna be walking you through either way, okay? And then when I'm sitting you down, I want you to reach back for the armrest, okay? But it's okay, I'll walk you through it, alright? So, remember, on 3, you push off with your arms, okay? Alright, so 1, 2, 3. You can grab onto my palms if you want, there we go. Now pivot, 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 there we go. Now, reach back to the armrest for me. With the other hand too. Now slowly, slowly go down, okay? Is the back of the, is your back touching the back of the chair? Can you feel it? Yeah. Okay.
For those of you that are wondering why he doesn't have a shoe on, it's because he has an amputation on the right.
Sanitize my hands. Wash my hands. Yeah. Alright. Make sure you have the cold water right there with you, okay? How you doing so far? Good? Alright, Miss Young, so you have the cold right there with you. I'm just gonna go ahead and grab your crutches, okay? Alright. So, you told me you've seen these before, right? Alright, so before I teach you how to do these, how to work with these, alright, what we're gonna be doing first, I want you to tell me your height, so I make sure that it fits you well, okay? Alright, so if you could please tell me how tall you are?
5'6".
5'6", okay. You have the call bell right there with you, okay? Just do that. Alright, just bear with me 1 sec, okay? I'll be right back. I just gotta go grab another set. Alright, said you were 5'6". Oh, look, you speak you pretty well. You're 5'6". Alright, so I'm gonna be using this. You're gonna be using these. Alright, so before I get to that, before I get to showing you how to use them, hands. Right now, if I could have the cobalt. There. Just gonna leave these right here just in case, just so you know that they're right there, okay? What I want you to do right now, I want you to hold on to these crutches, like this, right here, on your side, here, okay. So I'm gonna be helping you get up, alright? And yesterday the therapist told me, for this one, actually, you did most of the work, okay? So I'm gonna be helping you out just a little bit. So I want you to just, you know, if you can do more than you did yesterday, that'd be great too, okay? Alright, so first, what I want you to do, actually, is if you could scooch, lay back, so you could scooch your buttocks forward for me. So if you could do that for me, a little more. Now sit up for me. Alright, there we go, that looks great actually. Alright, we're doing so far, good. Alright, so now, with this arm, I want you to reach to the armrest, over here, okay? Now, what you're gonna be doing with these two hands, you're gonna be pushing up, okay? And I'm gonna rock you back and forth, just like we did over there. Alright, and then at the count of 3, you're gonna push up. Alright, and you're gonna stand up. Alright, so 1, 2, 3. Alright, now pass that crutch, one of those crutches over to this side. Alright, there we go. Make sure that they're under your armpits. Alright, now what I want you to do on that side, I want you to make sure that it's 6 inches forward and 2 inches to your left.
I don't know how much that is.
Oh, that's okay. Alright. So just bring it about to this angle right here. Alright, a little closer. There we go. That is good. And then I want you to bring this one up to the same height, okay? There we go. Alright, so now I'm just gonna measure 2 fingers fit under the armpit area, right here, and now there's the angle, but I just want to make sure, if you could please, with this hand, if you could straighten it out like this, how I have on. Alright, and right there is the ulnar styloid process on the hand. Yeah. Do you want to make sure? Okay, here, you can grab onto it again. Alright, how does that feel? Good? Good? Alright, so now, what I want you to do again, I want you to pass this crutch over to that side and hold it how you were holding it at the beginning. Alright, now, slowly sit back. Oh, reach for the armrest with this arm. Alright, now slowly, I want you to sit back. Okay, there we go. How is that good? Is your back touching the back of the chair? Yeah, it is. Okay, so just gonna let go real quick. Ooh. If you could hold onto the crutches for me right there. Alright. Yeah, right there we go. Sanitize my hand. You just hold it for just a little longer, okay? Right there. If you could actually help me moving them just a little bit out of the way. Alright, there you go. You're doing great so far, okay? I'm just letting you know. Now I'm gonna wash my hands again. Alright, let me take those crutches away from me. Alright. Alright, Mr. Young, you have the cobalt right here, okay? I just gave you 2 just in case, alright? So, what we're gonna be doing today, alright? First, we're gonna make sure, just like I showed you, 6 inches and 2 inches forward when we begin. Alright, and then what you're gonna be doing, first, the crutches, and then your foot, sorry. Okay, just like that. But what I want you to do, crutches, then you're gonna push down, and then a little bump. And what I don't want you to do, alright, is to swing like this. I want you to always make sure that your foot is within the crutches, just like this. Alright? So, could you walk me through it? What comes first? Alright, and then what am I gonna do right now?
Swing to it.
Alright, but how I explained it to you, just one more time. Crutches, then you're gonna push down, and then hop. Alright? So crutches, push down, hop. So, could you walk me through that?
Crutches, push down.
There we go. Does that look good? Alright. Alright, you have the hobo right there.
Question, so what gait pattern is that?
Swing to.
Okay, and if he progresses, he has a prosthetic now, what, gait pattern would you attempt with him?
With a prosthetic? With crutches or another assisted?
Same device,
Same device?
just verbalize it.
I would attempt, can I have 1 minute?
You tell me at the end.
Oh, okay. Alright. I would start it with a 4-gate. 4-point gate? Yeah. To see how he coordinates. And if he does well, then the 2-point. And then of course, after that, hopefully he could be walking again, but then maybe with a cane. And then obviously by himself, but I don't know if that's the progression. Okay. Alright, so I'm just gonna be taking these off. How was that? Did you get a good view of it? Yeah. Alright, so we're gonna be doing it now, okay? Sanitize my hands. Sanitize my hands. Wash my hands. You have the cold those right there, okay? Alright. Now, we'll hold on to these again, just like we did before. Do you remember what we did? Alright, so just like that. First, I want you to lay back so your buttocks can scoot forward. Now sit up for me. Alright, right there. That looks great. Alright, so now, what I want you to do, remember, we're gonna swing back and forth, and then at 3, you push up, okay? And then you stand up, okay? Alright, remember, 1, 2, and 3. Alright, now pass this crutch over to this side, just like that. Okay? Alright, so if you could please show me what I just showed you just now. Crutches. Alright, so crutches, now make sure to look up for me. Alright, so before we get started, what goes first? And then?
Push down.
And then? Alright, so if I could please have the family member come so I could show you. So, what I want you to make sure is that when you're standing behind him, you stand behind him on his right side, and that your hand is on this shoulder, and that you have your hand on the gate belt. In case you're wondering where you could get these, you could get these on Amazon, alright? And now I'm gonna show you the sequence to how he's supposed to be walking, okay?
Can I just use the regular belt now?
Sorry?
Can I use the regular belt now?
It would be, no, this is the safer device, okay? This is the safest device to
Okay,
use.
thank you.
So, if you could please, demonstrate what we just did, What I just showed you? Crutches. Alright. So you see that? First the crutches, then he pushes down and a little hop. Crutches, pushes down and then a little hop. Just like that, okay? Alright, so if you could keep going just a little more. You tired? Alright. Just making sure. Alright. So now, what we're gonna be doing, we're gonna be turning, okay? You're gonna be turning that way. So, I want you to do the same sequence that we did right now. First the crutches, then a little pivot to the side, to that side, okay?
Now?
Yeah. So crutches, and then do the little pivot, turn. Make sure you leave some space for me. Are you okay?
Yeah.
Alright, make sure you look up, okay? Make sure you look up for me. There we go. Alright. So turn that way. There we go. There we go. There we go. Alright. So now we're gonna walk back to the wheelchair, okay? Alright, so let me see you do that. Alright, if you could actually turn a little more to that side, to your left. There we go. Alright, let's go.
I keep mine that way.
No. Go to the wheelchair. Alright, there we go. There we go. There we go. How you doing? Good? Alright, now let's do a little turn here. Make sure you leave some space for me. Alright, so turn that way. Okay. Okay. Okay, you're doing great. Alright, so now I'm just gonna be moving it backwards, okay? So now the sequence changes a little bit, okay? What I want you to do, first, I want you to hop back with your leg, and then you're gonna bring the crutches, okay? So do a little hop backwards for me. Now bring the crutches. Alright, now a little hop back again. Now the crutches, now another little hop. Another hop, there we go. Can you feel the back of the chair? Can you feel with the back of your knee the chair? Alright. So what I want you to do right now, I want you to pass this crutch over to that side, okay? And now with this arm, I want you to reach back for the armrest for me. Alright, it's okay, I got you. Alright.
I don't know what I'm
No, it's okay. So now you can, if you could slowly sit back down for me. Is your back touching the back of the chair? Yeah. So if you could please hold on to the crutches for me again. Just hold it for a little longer, okay? Just be right there. Remember the cold balls are right there beside you, okay? Right here, okay? How are we doing so far? Good? Wash my hands. Now let me grab onto these. You have the cold balls right there with you, okay? Alright, so now that we did this, alright, I just want to make sure I check up on your vitals again. I just want to see how you're tolerating or how you're doing so far, okay? So if you could please give me your left middle finger. Alright, I check those vitals again. Wash my hands. So now, if you could please hold on to that for me. How are we doing so far? Good? Now, we're just going to be doing some stair training, okay? Alright, how are we doing so far? Good? Alright, you have the cold bell right there with me. I'm just gonna grab the crutches, alright? Alright, Mr. Young. So, what I'm gonna be doing now, what we're gonna be doing now, sorry, my bad. What we're gonna be doing now, we're gonna be doing some stair training. But so far, from what the other PTA told me, is that you did most of the work, so you've been doing really good. I'm just gonna be helping out just a little bit, okay? So what I want you to do, sorry for this, I'm gonna give you my back, all right? Just for a little bit, okay? But if you have any doubts, let me know, okay? So first, you wanna make sure that your crutches are real close, okay? Just like this. And then you're gonna bring your, feet, you're gonna get as close it as you can, all right? And then you're gonna push down and then a little hop, all right? Just like this. And then you're gonna bring your crutches up. So you're gonna push down, then a little hop, just like this. And when we're turning over here on this side, like this. Always make sure on your strong side, okay? Like this. You're gonna do a little turn, of course, at your own pace, all right? And then get just a little close right here. Crutches first, and then gently come down, okay? Crutches first, and then gently come down. All right. So just so you can get a little bit of a better view of it. All right. You have the Pogo right there with you. So make sure first. What comes first? Foot. All right. How am I doing that? Am I gonna
Push up.
push down? Okay.
Yeah.
Push down, and then a little hop. All right. Then the crutches. Then you're gonna push down, and then a little hop. And always make sure that your foot is within the step. Okay? Always make sure. Always make sure of that. But don't worry, I'm gonna be here to help you out. If you miss anything, I'll be right here with you, okay? Don't worry about it. So now, just gonna leave these right here, okay? So, what you do right now for me, I want you to hold it onto these real quick, alright? You have the Pogo right there with you? Yes? Yeah. Alright. Alright. Sanitize my hands. Make sure I sanitize my hands. Alright, so, Mr. Yan, if we could please have that combo. Thank you. Alright, so, just like we did before, just pop right up in here. Alright, what I want you to do, remember, when we get up on the seat, you lay back, and then I'll sit up for me. There we go. You're doing great. Alright? Alright, so, what I want you to do, remember, with that arm, huh? Okay, and with this arm, you're gonna push up, okay? So remember, we're gonna swing back and forth, and then at the count of 3, you're gonna get up, okay? So, 1, 2, 3. Alright, now, pass this crutch onto this side. Alright. So, now let's walk to the stairs. Stairs, there we go. Let's go as you can. Alright, there we go. That looks great. Alright, so what are we gonna do here? Push down and then hop. There we go. Make sure you look up. Push down and then hop. Alright? Now, do a little turn for me. Yeah, that looks great. That looks great. That looks great. That looks great. Alright. Alright, now get a little closer. Just a little bit. Okay. So now, what comes down first? The crutches. There we go. And then slowly, gently come down. Alright, there we we go. You good? All right, now crutches. Then slowly come down. How's that, good? All right, now I want you to walk over to the wheelchair for me. All right, now I want you to do a little turn for me towards that side. All right. Now remember how to move backwards. All right, first the foot. Wait, actually wait. You could move over a little bit to that side. There we go. Now, first the foot, and then the crutches. Now the foot, and now the crutch. Can you feel the back of the seat right there? No? Just do a little hop. There we go. Can you feel it now? All right, so now pass this crutch over to that side. All right, now drop onto the armrest with this other arm, and slowly get back down, sit back down. How's that? Good? Alright, back. Is your back touching the back of the chair? Can you feel it? Alright, now I'm just gonna hand you the call bell. And you have the call bell right there with you. I want you to hold on to those crutches for me. Could just move these out of the way for me. Yeah, right there to the side. Thank you. Alright. Wash my hands. Let me grab onto these. You have the call bell right there with you, okay? For one last time, let me check up on your vitals, okay? How's that? Good? All right, Mr. Young. So we have finished our therapy session for today. All right. If you have any, do you have any questions? All right. You did great today. I hope you can do better tomorrow, and you're on the right track. Okay? It was nice meeting you, Mr. Young. Wash my hands, and I'm finished.
You're gonna take your gate bell with you? You're gonna leave it again.
That's the question I had, but
You can take it with you.
I can take it with me.
Does he have a call bell?
Yeah, he has it right here.
I thought I was the only one that got out of breath showing these transfers, but it's a lot.
If that's just one patient, how many orthos on your caseload for the day, guys?
Yeah.
Think about it.
You have to take the gable off at the end?
Alright.
In if you're in a facility and the patient is gonna be seen by OT, that's probably like an inpatient rehab. Each patient had their own gate bell. And if we left them at bedside in the chair, then we would leave the gate bell on. But again, that just depends on the facility where you're at and what's coming next for that patient. Alright.
So we don't have to bring them back to their room, we
He
leave
will
them.
tell you where you want them.
Oh.
If I wanted him next to the bed, I would have told something. I would have wheeled him back to the next to the bed.
Oh,
Okay. So thank you for doing that. Really appreciate you putting yourself out there. So I just want to go over the forms for transfers. He checked. The only thing question was, did you say that you checked everything was safe and clean prior to you washing your hands? Make sure that when you're doing your setups, you say, cleaning my crutches that I'm gonna use with my patient. I'm checking my wheelchair, make sure everything works as far as the locks and everything. He washed his hands before and after. He identified the patient. He identified himself. He obtained verbal consent. He applied the footwear carefully. He applied the gate belt appropriately. The patient was monocyst with bed mobility, so he asked him to bridge slightly. He monitored patient tolerance throughout the entire procedure, checking on his patient. He did vitals the one time. He did vitals the second time. He did vitals that third and final time. He provided the call bell always in front of the patient. He removed any obstacle from the path. He made sure the patient's back was against the wheelchair, that wasn't an issue. Always had the hands on the patient. One thing that you just wanna make sure that you do is when you were over here, when you transferred him over into the wheelchair, and you were putting on the leg rest, the wheelchair was unlocked.
Oh.
Right?
Okay.
Immediately after you were done with the leg rest on, you didn't even have to unlock it because it was already unlocked. So
Okay.
as soon as he transfers, I think you unlocked it when you moved it away from the chair, from the plinth.
Yeah.
But then you forgot to lock it. I don't know
Okay.
if you did that side, but this side was unlocked.
Okay.
When we see things like this, guys, you may see us like snapping a picture. Just don't get alarmed. It's just so that we can show you for your improvement. All right. So when we take pictures when we see the wheelchair unlocked or when we see something that's out of the ordinary, that's a safety issue. As far as the actual transfer, it was good. Just make sure that you bring that wheelchair closer to you. The safety thing was that you couldn't let go of the gate belt, which you did, right? But it was like really far from where you had transferred him to. The other cue that you got was scooting the patient up. You have to scoot that patient up more than once because his uplineal region was almost touching the back of that mat before I gave you the cue and you moved him up. It's gonna be harder for that patient to get up and it's gonna be harder on you to get that patient to standing if they're sitting all the way back, right? The other thing is you were kneeling when you were doing the scooting. Does that work better for you? Because I feel like if a patient like topples over or like gets dizzy, it's gonna take some time for you to get up so that you can help them recover. So I never knelt when I scooted the patient up in the chair, but as long as you're safe and your transfer looks good, then that's fine. Just be careful with that, because when you have those patients that don't have good tongue control, they're gonna end up laying on top of you and you're gonna need some time to recover to get up. Okay. When putting on the leg rest, not all patients are gonna be able to have their leg hang on your thigh. Especially with my knee replacements that maybe don't have that full extension, that's gonna be painful for them. So you have to be careful with that maneuver. It's not wrong, but it's not gonna be good for every patient.
Okay.
Alright, for the sniff your pits comment, it's fine. Just I would just tell my patient like, can you check to see if you put on deodorant today or something like that, something to that extent. But try not to bring the arm so far up, because then you're gonna have trouble getting your hand under there. So that's why you might be best, because you can easily slide under there rather than have him like, oh, can I get in here? And then he was kind of like fidgeting with his arm. Alright, so just keep that in mind, because you don't want to sit the patient up and their arm be like stuck like this and your hand jamming that arm. Like that. So always be careful with that. Anything with the transfer? Directly?
No, the scooting, the word I'm hearing, since we're correcting sniff the pits. Guys, when I say sniff the pits, that's just for you, a visual for you. Visual for you. Maybe like Mr. Pinzone says, just like that, or look towards your underarm, something, or look at your underarm, something, find something else other than sniff the pits. And then, for the scooting, it's actually scoot forward, not scooch.
Oh.
Scooch actually is not a word. So scoot, that's S-C-O-O-T, scoot.
Oh.
That was the only thing that was.
So neither of the two is like safety items or verbal cue, it's just to kind of finesse your verbal cues to the patient.
I'm sorry. On the wheelchair that I had it unlocked, I can, when he's sitting down and I want to get that space, I can unlock it, but then I have to lock it again.
Lock it right back up.
Okay.
So that when you put the leg rest on, maybe the wheelchair will not allow, if it's unlocked, it's gonna move back and forth as you're trying to hook that on there,
Okay.
right? Just be careful with that. Your selection of assistive device was appropriate, your selection of transfer was appropriate for this patient. Your assistive device fitting was appropriate, there was no safety issue. I think you bumped his leg. When you were fitting the device, when you were sitting him back down.
Yeah.
So just be careful with your patient's legs, be careful with the involvement.
In this case, you wouldn't bump it. In this case, you wouldn't bump it.
You wouldn't have done anything.
You're gonna have CT.
There's still a residual limb there that you can bump. So, okay. There is a lower extremity.
I did have a question on the question that you asked him.
Yes.
Um,
So I asked him, what will be the progression if now the patient has a prosthetic? Right?
I was-
3-point gait pattern. He chose 4-point, 2-point. It's not incorrect. The most logical progression is probably putting the patient maybe on a 3-point gait pattern on this, and then
wouldn't it require like more information? Like when did they just get the prosthetic or?
no, because I mean, we should when they're fitted for a prosthetic. Okay, we've already been gait training, so now they just have this prosthetic. So now they're gonna attempt gait training. Could you have said if they just got the prosthetic, maybe putting them in the parallel bars just to see how they're gonna do? That would be a good place to kind of check it out, right? But yeah, you can ask me like how long ago, and then I'll say something. Say like I don't know, 3 weeks ago. Maybe from that you can make a decision.
Okay.
Right?
What about a swing through?
Swing through. Okay, but what we want to do with the prosthetic is kind of dissociate
Put it on the
the
ground.
legs. Right? We want them to get to a normal gait pattern because swing through shouldn't be required if they have a prosthetic. We want to allow them to actually do reciprocal gait. Right? But anything with device fitting, Dr. Ekman? No. Gait training, I really liked your encouragement to the patient throughout. You're doing really great. That was when you checked your vitals the second time. You chose a swing to gait, which was appropriate. You explained really well. You called me over to do the caregiver training aspect of it. I saw your patient turn to the weaker side during gait training, and I saw your patient turn to the weaker side during stair training as well.
They did? No.
He turned over. Oops. He turned over to that side.
To the left,
Yeah.
because his left is his strong side. On the right, he has the
Right,
amputation.
right. You have to turn. He had a right amputation.
Yeah.
Alright, so the gate belt was a little loose, and I saw you pull it, so I didn't notice that it was.
But it's because when I always put it, it's tight.
Okay,
But
so
It's a
when
moment, that's it.
the time to kind of tighten it is maybe if you didn't put it tight enough, then tighten it when he's sitting